Hello everyone, I'm Dr. Saurabh Sharma, glaucoma consultant in Bharti Eye Center and Foundation. So today I'll give you a short video regarding glaucoma, the specific, it's known as the silent killer of sight. So glaucoma is a disease, a multifactorial disease which affects the back part of the eye, particularly the optic nerve, which takes the impulse, the light from the eye to the brain, from which we see. As it is known as a silent killer, the major problem in this is we don't have any symptoms for glaucoma. Most of the patients will not realize that they have glaucoma unless and until the 50% of the nerve is already damaged. And that 50% will not be able to do anything because it is irreversible loss of blindness. So, very important thing in glaucoma is to early diagnosis of glaucoma, and that can be done by knowing about some risk factors of getting glaucoma. The major risk factor is of course age. After 40 years of age, many people tend to get glaucoma, particularly those who have a family history of glaucoma. So if anyone in your family have glaucoma, or generally known as Kala Motia, you are at 3 times more risk of getting this dreaded disease. Other than that, if you have a minus glasses known as myopia, those people also have a risk of getting glaucoma. Then if you have thin cornea, the front order of the eye is thin, or if you have some associated conditions like diabetes, high blood pressure, thyroid eye disease, migraine, or if you snore at night, these are also some general risk factors of getting glaucoma. So as there are no general symptoms of glaucoma, the early diagnosis of glaucoma is very important, and that can be done only by a general eye checkup. So after 40 years of age, particularly those who have risk factors should get their eye examined at least annually. And those people who have the risk factors like family history, migraine, they should definitely get their eye checked after 40 years of age. And in checkup, the doctor will generally see the pressure of your eyes, he will see the nerve, whether you are getting some changes, and he will do some tests for a scanning of the nerve or the visual field examination. Because in glaucoma what happens is, the visual fields start to compress slightly from the peripheral, and in the end only the center part of the visual field is left. So some people who are very aware of their surroundings, they will tend to know that their visual field is slightly compressing, or they are seeing some black spots in front of your eyes. That is an early symptom of getting glaucoma. Plus those patients who are reading more often, they also sometimes they realize that there is frequent change of their reading glasses. That can also be one symptom of glaucoma. In a few subset of patients, which is known as angle closure glaucoma, those patients can come to us with actual symptoms of pain, redness, and these are a specific set of patients who have very small eyes, having plus number of glasses. The eyeball size is very small, so they can have some symptoms of glaucoma which can be early detected, like they will come to you with heaviness of their eyes, being a pain, redness, or something, loss of vision. That can be detected early, but that is a very few subset of patients. The major patients will not have any symptoms. So after the investigations, if you have glaucoma, then generally we start with the glaucoma eye drops initially, and it can be 1 time a day, twice a day, depending on your profile and depending on which eye drop will suit you. And that has to be taken like your daily diabetic or hypertension medications. It has to be daily without any fail. And if that eye drops, then the doctor will call you after 6 weeks or about 2 months to check whether the eye drops are working for you, if the pressures are controlled with the eye drops or not, suitability to your optic nerve. And then if it is everything is okay, he continues with the eye drop, or he might be thinking of changing the eye drop in future, or adding some other glaucoma eye drops. If the eye drops are not able to control the pressures, then also we have options like we have some laser procedures to decrease the pressure of your eye, and ultimately we have surgery as well, trabeculectomy surgery, or some valve which are designed to control the pressures of the eye, and that is done only when the glaucoma eye drops is not working. So the major point in glaucoma is the early diagnosis of glaucoma is very important. The early we diagnose this dreaded disease, this will be easier for the doctor as well as the patient to control this problem.